want all of our patients to be aware that risk factors for heart disease include a history of high blood pressure, high cholesterol, are you a diabetic, and how well is your diabetes controlled. Activity level, a family history is so important. Also, history of tobacco abuse, very important too. Women do present differently with heart disease, definitely. Now, some of them do have the typical elephant sitting on my chest type symptoms, but women typically present with things like a fullness, pressure, heaviness. Sometimes they report that they have some jaw pain, neck pain, shoulder pain. I've even had some patients that report shoulder heaviness or feeling like my arms feel really heavy. The other symptoms, and that's symptoms that women typically overlook, are the cold sweats or nausea. A lot of times they want to try to write that off as, well, I've got a little bit of indigestion, or I'm having hot flashes because of hormonal changes. The biggest thing for women to remember is activity intolerance too. And it's not the intolerance of, well, I haven't worked out for a while. It's exertional in nature, to the point that you have to kind of slow down what you're doing. And I find that women underreport their symptoms pretty frequently. A lot of times women will be concerned that, well, what if everything is okay? I'm going to be embarrassed if this really isn't my heart, if it ends up being an anxiety attack. But it's very important for them to come in and report any symptoms whatsoever to us. And our job is to try to go through the information so that we can identify those patients at risk and then do the appropriate treatment. You only have one heart, and once the damage is done, it's typically done. So we want to try to expedite care as much as possible.